the right place. This is the MDMOM program webinar series, and today we're talking to folks who've had babies during the pandemic. So just gonna wait a couple seconds, make sure we've got everybody in there. Okay. All right, so why don't we get started? I want to say good morning, good afternoon. My name is Nicole Warren, and I'm an associate professor at the Johns Hopkins University School of Nursing. And I want to welcome you, as I said, to the MDMOM program webinar series. This is actually the fourth in our series. And previous to now, our topics have been around COVID, just like today, but they have been with medical experts, really helping us understand how they care for women during the COVID pandemic. Today, we are doing something very different, but very much related, and we are going to hear from another set of experts. These are childbearing people, in this case, all women, who have had babies during the pandemic. So I am going to go ahead and just stop sharing my screen and introduce you to our panelists. So we have a group for you today, and this includes Sally Safi, Sarah Baker, Aubriana Musser. We also have another guest who is joining us on the line with a medical interpreter, and as soon as they are set up, I will introduce them. So maybe and Habiba Oguntude, of course, is with us to help as well. And wait, Sarah, you can introduce your guest in just a sec. We may have some guest appearances. So first, could I go around and just briefly ask each of you to just say, you know, your name, when you delivered, how old your baby is, and if this is your first child or you have other children, and then we'll get into sort of some more substantive questions. Sally, do you want to start?
Sure. Hi, I'm Sally. So I had my first baby, Ada, on April 18th. So she's about 4 months old now.
All right, Sarah, how about you? I'm just going to go around in the circle that I see on Zoom. Who have you got there?
This is AJ. He was born on June 13th, and so he is about 10 weeks old now, and he wants to say hi.
This makes some very cute noises. Okay, Aubriana, tell us who you are.
Hi, I'm Aubriana Musser. I just had my second baby, Ahsoka. She was born on July 3rd. She did not want to be a holiday baby, so she's about 7.5 weeks now. And like I said, that's my second child. My first is a boy, and he's about 3.
So you came into this with some experience then?
Yes.
Got it. Okay. And then I'm going to pause for just a moment and see if Yoni, our medical interpreter, has our fourth guest on the line. I'm going to hold just a second and see if she's there. Hopefully we'll get that ironed out shortly. And I want to start with sort of where all things start with pregnancy is being pregnant. Obviously that happens before you have the baby. And we know that that is always a time of expectation and uncertainty and excitement. You all went through this during COVID. I remember when I realized COVID was not just in the world, but it was going to affect me personally. And I wondered if you could talk about, when did you realize not only is this thing, you know, for real, but it's actually going to have a bearing on my pregnancy? Sally, do you want to start?
Sure. So I think COVID really started to hit and become real when I was about 8 months pregnant. And I was preparing for birth, and I had made a birth plan, and I was trying to be really flexible about what my birth experience would be like, and try not to have any expectations about things going a certain way. And then when I knew that COVID was probably going to affect my birth, I remember having a couple of like pretty tough days, because there were stories in the news about moms with COVID who were separated from their babies at birth. And I knew that Hopkins was going to have a policy where I was not going to be allowed as many support people as I wanted. So I remember it being really tough. And I guess I kind of coped with that by just reading as much as I could, looking at my birth plan and trying to think about how certain things might be affected by COVID and what changes I could expect. And it really just came down to me hoping that I didn't test positive for COVID when I had the birth, so that I wouldn't have to have that challenge of like possibly be separated from my infant. Luckily, I tested negative when I was admitted to the hospital, but yeah, I remember it being pretty scary and overwhelming. But yeah.
Thank you. Brianna, I see you down there nodding in agreement. Is to tell me about when you realized this was going to affect your pregnancy, and what about, I'm curious what Sally said got you nodding there.
So in the beginning, it was very confusing, just with, what everybody was saying in the news. A lot of people were like, it's not that serious. Nobody needs to wear a mask. And then all of a sudden it was a huge turnaround, and it's like, okay, social distancing, you have to wear a mask. We can't go out. Businesses were shutting down. I ended up losing my job. So that's kind of when it like hit me like, okay, this is very serious. And then like she said, the thing that I was most worried about was being separated after I had given birth. Because I know, like she said, I've heard stories from moms, and like I'm in like mom groups and things like that, and they were saying that they got separated from their babies until they got a negative test result back. So that took like a couple days even, and that first couple of days, like those first 2 days are very, very crucial with making that bond with the baby. So that was like the main thing that I was worried about.
And Sarah, what is amazing about this panel, even though we're a small group, you each have a really unique story. Sarah, what about for you? When you realized that COVID was going to intersect with your pregnancy, sort of when did you, tell me about that?
So I remember like one of my last few days at work, I was 28 weeks pregnant, and I went to my midwife's house for my glucose test and everything. And it just like changed everything completely. Like there were no, there was no more maternity shoot. There was no more baby shower. There were just so many things that were different about it. I had planned on having a home birth with a midwife ever since I found out I was pregnant in October. And so really like nothing about the birth plan changed really. Everything was still the same, that she was gonna come to the house and I could still have my doula and everything. She did require that we were COVID negative, like for all in-person prenatal visits, and then the birth and the postpartum visits as well. My husband got COVID from a coworker when I was 36 weeks pregnant. And so that was a whole nother thing in itself. It ended up being a really stressful situation because I had to then get a negative COVID test before the birth, and CVS lost my test result, and it was crazy. Like, I didn't find out that I was officially negative until the day after my due date. So it was an adventure.
Wow. Okay, that's a heck of a build up to your delivery. Now, you mentioned that you had a home birth, and I just want to acknowledge, I think there's always been discussion around home birth and safety, and so this certainly has come up more with COVID. Aubriana and Sally, you also were tested when you were admitted, I'm assuming, to the hospital to have your babies. Aubriana, is that true for you as well?
No, actually, my hospital did not test me at all. But I knew I didn't have any signs, symptoms, or anything like that. And I've been at home for months and months previously. So I knew I was okay.
Okay, that's helpful. And Aubriana, I should have said this to begin with. Aubriana and I have been texting a little bit over the last 24 hours. Aubriana, I think folks who are joining us are going to notice that you are in an inpatient facility.
Yes.
And I just want to, out that. And I realize for you now, your baby is almost a couple months old, but no one expects in their postpartum time period to be hospitalized again. And I want to wish you well. And as we talk, certainly share what you'd like, but I do want to acknowledge that you are inpatient and we're gracious enough to join us today.
Thank you.
Okay. I'm going to check in just briefly with Yoni to see if we've got Bonfilia on the phone. And Yoni, can you hear me? And do you know if we were able to get to Bonfilia? It's fine with me. If you want to ask her if she'd like to share what it was like being pregnant during COVID, we could come right back to you and hopefully hear her response to you on the phone. So Yoni, if you want to have her respond to that question, and then we'll come right back to you and we can hear her perspective, would that be okay?
Yes. Señora, ¿cómo fue estar embarazada en esta época de COVID para usted? ¿Cuáles fueron sus temores? ¿Cuáles fueron sus preocupaciones? It was very hard for us because my husband and I lost our job and we were just here in the house, and I got into a depression. It was very hard because we lost our job and we were very afraid. We were just here in the house.
Wow.
So I was very afraid because my fear was that I was going to have to deliver my baby here at home, because they were telling me that the hospitals were not seeing patients, and so I was very fearful that I was going to have my baby here in the house. She said it was very fearful because I thought that I was going to have my baby in the hospital, but then when I went to the hospital, my fear was that I was going to be infected there. But the experience was quite different, because after my baby was born, they bathed my baby, they cleaned my baby, and they put us in a room, and we didn't leave the room afterwards. And the nurses were coming and they took very good care of my baby. They were all dressed up and covered, and they protected themselves and they protected my baby to the point that I was feeling very safe there, because they really took care of my baby, and they were taking all of the precautions necessary to protect us while we were in the hospital.
That is, so what I'm hearing are a lot of common experiences and some really unique experiences. So this is a great segue into talking a little bit about what it was like to have COVID and be in your birth environment. Now, I think Bonfilia mentioned that she was concerned she might have to have a home birth. Sarah chose that. I just want to say, from a home birth perspective, for families who choose home birth, we know that a planned home birth is the safest. And I think Bonfilia is referring to sort of, having to do it without that plan. So I just want to acknowledge that. Sally, I saw you nodding when Bonfilia talked about the good care that she experienced in the hospital. Can you talk about a little bit about what birth was like for you? And then we'll go back around to Abriana and Sarah. What was it like for you when you were actually having Ada?
Yeah, sure. So one thing that was different was I thought that I would be able to have a doula and my husband with me in the hospital, but I had to choose one support person. So my doula provided virtual support over the phone, but she actually ended up helping me the most while I was in labor at home, which was actually like a few days of like come and go contractions. But when I actually got to the hospital and was admitted, it was just my husband there with me. And honestly, I feel like I sort of forgot all about COVID for when I gave birth and when I was there for a couple of days afterward. The providers were wearing masks, but other than that, I just sort of forgot that COVID was even a concern, and like that I had been so worried about it. I think that everybody was taking precautions, and I felt very safe. And I would say, yeah, had a really great experience in the hospital overall.
As a nurse, as a former labor and delivery nurse and a midwife, it is so reassuring for me to say that for at least part of your labor, you were able to forget and just be in your labor. I know that must have been tough. Abriana, what about for you? When you were actually having your little one, were you cognizant that I'm doing this in the middle of a pandemic, or what was that like?
Honestly, like that whole day, I was just like, it went out the window. I was just so focused on getting that baby out. I was so ready. And honestly, the day that I went into labor, I didn't even know that I was going to have her that day. My water had broken, but I didn't even know. So it was the weirdest thing. So I ended up going in late. And after that, it was just so quick. It was the easiest labor I've had. I felt very safe. I honestly didn't even think about the COVID or anything like that. The only thing was, like she said, I could only have one support person. So my husband was there, so my mom didn't get to come up, and my grandmother and all of them, so they didn't get to meet the baby or anything yet.
Yeah, COVID has taken away so many rituals, so many comforts, from support people to just routines. It's impressive. It's humbling how much COVID has changed our lives. Abriana, when you were delivering, did you have a sense from the care team that they were stressed, or this had changed their care process in any way? Or did you feel like, it was a day in L&D as a unit as usual?
Yeah, it just seemed like a regular day for them, honestly. Like I said, it was super quick, so they were just very professional. It happened, everything went smooth, and shouldn't have to shouldn't have any complications or anything like that. So everything definitely was like perfect.
Okay. And Sarah, for you described earlier that your COVID results really came like basically right when you were expecting to deliver, and it really had implications for your care environment. This baby's really cute. Sorry. Tell me about, in terms of delivery itself, do you feel like COVID had a bearing on your actual labor and delivery experience or day beyond the testing?
Not really. I think she had noted that because like if you have COVID, like it might be in your bodily fluids, and then when she's like helping you in the pool, that's kind of risky. But other than that, I didn't end up delivering in the pool. I just labored in the pool. And I liked being able to have both my doula and my husband. I think if I had to go to the hospital and I would only be able to have, I would probably choose my husband over my doula, and that would have been the wrong choice. When labor first really started to rev up, I tried to, we could practice the double hip squeeze before, but then he forgot all about it, and I tried making him watch the videos and showing him, and it did not work. So no, my doula was amazing, and she really anticipated every need, and I never had to ask for anything. She was just there. So yeah, other than everyone wearing masks, well, my husband and I didn't, but the doula, midwife, and the birth assistant did. Other than that, it was just someone else's birthday.
I love it. I love it. I think this theme about the importance of support, not just in the labor and delivery space, but also prenatally has come up. And you also you've all sort of mentioned stressors and concerns you had. And Yoni, I wanted to ask Bonfilia, she mentioned that the uncertainty she felt sort of created or contributed to sort of feeling depressed. And I wonder if you could ask Bonfilia, if you can share with us, how did you cope with the uncertainty of COVID? And I'd ultimately like to hear that from each of you, but were there particular strategies that you used? I'm asking this because there could be expectant moms listening. Were there strategies or resources that you have used, and I'll start with Bonfilia, to help manage your uncertainty?
Bonafilia, usted mencionó que usted tuvo como esta incertidumbre durante el COVID. ¿Hubieron algunas estrategias o técnicas que usted utilizó para lidiar con esta situación del COVID? Para mitigar su preocupación? Every time we will go out, we will come back and use disinfectant and disinfect everything and takes our clothes off, and because we were afraid, so we were just having all of these precautions because it was too much.
Okay, any other strategies, Sally or Aubriana? I know Sarah's got her hands full for the moment. Any other strategies that you found to sort of cope with the uncertainty that COVID, brought about for your pregnancy?
I think for me, mainly it was just kind of go in with the idea of kind of have a plan, but let it be flexible. So that way you, one, don't get your hopes up if, things don't go to plan. And then two, you're also mentally prepared if you need to go another route. So I think that takes a lot of stress off of it. So if you planning on doing a home birth or a hospital birth or whatever your plan is, you don't want an epidural, just things like that. Think about that and just be very flexible. Have an open mind. Okay, if my pain is too bad and I need an epidural, would I be open to it? Would I be open to, other things if, it doesn't go the way that I want it to? And then, like Ophelia was saying, just, protecting yourself and making sure that, you're taking all the necessary precautions, sanitizing, and just keeping up with your health.
Brianna, you're almost like a plant from the Centers for Disease Control. You're telling us all the best guidance is just do what we want everyone to do. That's awesome advice. And it means so much coming from someone who's experienced it. Sally, anything that you want to add in terms of coping mechanisms? And then I want to sneak into what it's like having a newborn during this time.
Sure. Yeah. So I have a couple of things. One is just like, don't feel like you have to have a home birth. I think I was really happy to hear that everybody on this felt pretty good about how things went in the hospital. And like you said, Nicole, home births are best when they are like planned well in advance. I think at the time that I gave birth, there were a lot of women who were sort of like panicking, trying to have switch to a home birth, which is totally understandable. But I think what I was reading was that might not be the best idea if you don't have enough warning. So don't be afraid to give birth in the hospital, I would say. Also, just like talk to your provider about what the rules are. I remember things were changing so much when around the time that I was set to deliver. And so just knowing what to expect was really helpful, kind of like knowing what the rules were. And then can I plug evidence-based birth? Which is just emails that I get weekly. And the woman who's in charge of that provides some summary information about the research on COVID and what we kind of know at this point. And I actually got, she provided like an informed consent form that I took with me to the hospital where I was gonna refuse separation from the baby if I did test positive. So just like having that resource felt really good to me, and just helped me feel more prepared. Yeah, those are my tips.
That's awesome. So preparation, flexibility sound like key strategies. So you go through a part of your pregnancy, obviously with COVID, you have these little ones, and now you're a new mom, and that is always fraught. Even in the best scenarios, that can be stressful. So you do it during a pandemic. And I'm just curious, when I think about new parents, I think about all the new things you need in terms of resources or gear or just information. Can you talk about the transition to having this new addition to your family during a pandemic, and what, if any, influence the pandemic had on your ability to access the things that you needed to be a new parent? And Sarah, I know you're just back, so maybe I'll start with you and then we'll go around again. Is that okay?
Sure. We just had to do a quick diaper change in there.
I'm very impressed that you're doing this with your baby. I would not be able to focus.
Where do I even begin? Yeah, I saw a post on social media a while ago that was like, don't be a martyr. Like, if you need the help, you need the help. Because and I've still had friends and family come over in masks, because it's like, I can't do my dishes and feed my baby at the same time. So it's been a lot, and my husband did not have a lot of vacation time, and he had just started at his new job less than a year ago, so he didn't qualify for paternity leave at all. I think generally, like, postpartum is just such an isolating time, and COVID has just made it even more isolating. I mean, I have had family and a couple of friends help out, but then I've also had people that I had expected would like bring over food or do something and have just kind of not. Just trying to be socially distant and do what they think best, health and safety being experienced.
I think, you know, that need for help, obviously, that we always encourage new parents to ask for, but in a time when that could be unsafe to get. That's a very fine line to walk. Abriana, I'm looking at you in this inpatient facility. Do you want to share a little bit about your experience being a new parent? Because obviously we focus a lot on pregnancy and labor and delivery, and we know that a lot of illness and even death for women occurs in that postpartum year. So maybe you can weigh in on COVID and the postpartum period for you.
Yeah, definitely. So it was very difficult at the beginning, like Sarah was saying, like it really wasn't a lot of help available to me. All of my family was out of state except my in-laws, and you know, we were trying to social distance and make sure we were all safe because my brother-in-law had actually passed away from COVID, so we had to separate ourselves for a little while just to make sure everybody and you know their household was okay before they came around the baby. So it was definitely difficult with a toddler running around. But you know, we finally got into a groove, and my husband didn't have a whole lot of time off either because he had just started his job as well. So it was basically just me. So it was pretty hard. And I definitely encourage like anybody, if you're feeling something and you know it's not right, go in and get checked. You know your body, you know when something's not right. I ignored, you know, my symptoms for a while, and I ended up with 2 blood clots in my legs, and that was from the pregnancy. And it happened so far out postpartum. They were saying, you know, that was pretty rare for it to happen this far out. So just like any warning signs, like if you have any lumps in your breast, if you have any pain in your legs, or notice like any changes in your body, like definitely go in and get checked out because you don't want to be in the hospital again like me.
Wow, Brianna, first of all, thank you again for joining, and I'm glad that you're feeling better. And it's a pretty compelling message to listen to our bodies and to let our providers know repeatedly if we need to. Thank you for that. Yoni, I wanted to ask Bonfilia if she has any reflections on what it was like after she had the baby. What has it been like to have this newborn during a pandemic?
Bien, señora Bonfilia, yo quiero preguntarle sobre reflexiones. Después de tener a este bebé, ¿cómo ha sido su experiencia con la pandemia? Well, it was difficult because we have been isolated here, but it's good because my sister-in-laws have been helping me quite a lot. They have been calling me, asking me how I'm doing, and so my recovery has been very nice, thankfully.
Can I ask, and maybe I'll start with Bonfilia and then go back around. Have there been any resources, and that could be, you know, with hospitals or agencies or anything that normally, you know, Bonfilia, that maybe you were looking to access that have been interrupted because of COVID? Have you had any loss of services because of the pandemic that you had counted on?
Señora Bonfilia, le quería preguntar, ¿ha habido alguna fuente de recursos, como por ejemplo organizaciones, hospitales, algún tipo de recurso que usted estaba buscando antes de la pandemia que ha sido interrumpido debido a esto del virus? ¿Ha tenido usted esa interrupción en los servicios que necesitaba? No, thank God, no. No interruptions.
Wonderful. And then how about for you, Sally? Have there been any things that you were counting on that you've actually had trouble accessing because the pandemic had being a new mom harder in some ways?
I don't think so. The one thing was that my mom was going to come right when the baby was born, and we ended up deciding not to do that because of COVID. So, you know, we had less family support right in the beginning, but nothing in terms of like other resources that I can think of have been affected.
How about Abriana or Sarah? Were there any things that you were counting on to be supportive, either personally or, you know, socially outside of the family unit, that you feel have been interrupted or compromised because of COVID, that maybe are making it more challenging for you to do the hard work of being a new mom?
For me, I don't think anything really was interrupted. Because pretty much everything else is pretty much unnecessary at this point. You know, I wasn't going to risk my health or my baby's health to go out and do too much. So if it wasn't like a necessity, you know, it was kind of like, you know, I'm not going to do it, or I don't need it necessarily. So I pretty much had everything that I needed.
Okay. Sarah, did you want to add anything to that? Oh, I think we lost her on the screen. Okay. Now, look, we all know there's been some really interesting evidence around the mental health of the childbearing person, in this case, obviously a group of women today, but partners are involved and partners are affected by what is happening. And I'm curious if you can reflect on the extent to which COVID and pregnancy, that intersection, has impacted your experience co-parenting or with other loved ones in your life or other people who care about you. What has it meant for the people around you? Because they love you, and here you are having a baby in the middle of COVID. I'm curious how you have navigated that with people who were your cheerleaders. Sally, do you want to start?
Sure. What comes to mind in terms of how my husband has been affected was just that he is working from home now. And so when I was on maternity leave, he was working from home. And that was actually really nice. And I totally acknowledge that we're very lucky to have had that opportunity, but especially with my mom not coming, having him around just so I could like hand him the baby if I really needed to, or he could you know, help me do stuff here and there while he was working from home was really nice. And I guess I would say, as disappointing as it was to not have family meet Ada, we didn't have family come until she was about 2 months. I did sort of appreciate the time that we had as a family, just the three of us at home, and just sort of like not having that. We couldn't really go out, and not having that pressure to feel like I needed to like figure out how to get the baby in the stroller at 3 weeks postpartum and go grocery shopping or something. That was kind of nice in a way, to just feel like we could just stay at home and take it slow.
Okay, that, you know, anytime we can find a silver lining, I'll take it. So I'm going to go ahead and chalk that up to a COVID silver lining, that some of the pressure was off of you to sort of go out, business as usual. And there was, it was okay to just stay at home. And I'm glad that you got that upside at least.
I definitely resonate with that. I think there's this pressure to bounce back, and it's like, no, we're all staying at home anyway. And even with pregnancy, like those last few weeks, I work in a lab at Hopkins, and I would have been running around the lab at 39 weeks pregnant with my feet swollen, and instead I was, you know, working from home on the computer. So I think there's always those little silver linings in there that you have to find.
Absolutely. And I forgot to tell the folks that are joining us today, I apologize at the beginning. I wanted to check in with Bonfilia, but we are going to open it up for questions. So if you want to chat a question or use the Q&A, if I didn't say that before, just wanted to let you know that opportunity is coming. Bonfilia, I wonder if you could share with us a little bit how you have navigated this. Well, you have shared how you have navigated it. Has there been any challenges with your family? For example, maybe different perspectives on what you should or shouldn't be doing with the newborn. How have you navigated how your family thinks about COVID and pregnancy coming together in your lives?
Bueno, Arfilia, quiero preguntarle, ¿cómo ha navegado usted en algunos como cambios que han habido con esto, lo que las anticipaciones de su familia sobre cómo usted debe de manejar, cómo tener a su nuevo bebé y cómo debe de conducirse con respecto a eso, las precauciones o digamos así, cómo debe usted actuar alrededor de su nuevo recién nacido? ¿Ha habido algún cambio con las opiniones de su familia sobre esto? Yes, that if I don't have to go out at all, just to stay home and just as a precaution, just for the safety of the baby.
Yeah, just lots of extra caution about these little ones.
Sí, como mucha extra precaución con estos pequeños, ¿no? Yes, yes, and it's too much, and they come and leave me things outside, but they don't come in because they said that the baby is too small yet.
Oh, wow. Okay. Yeah. So I think in every family really navigates that differently, right? And that is the same, whether you're talking about where your baby sleeps, how your baby eats, you're going to do whatever is right for your family at that time. And I love sort of the variety we're seeing here. Abriana, feel free to, you know, if you need to change your status, let us know. Okay, so what I want to do now is open the floor up to any kind of questions. So I have a couple more for the panelists, but if you have questions, you can put them in the Q&A or the chat. It's been a while since I had a baby, but one of the things that came to mind and I wanted to ask you, I felt like after the fact, we often have ideas about what we would do differently or what we might tell our friend or our sister. And I'm curious, what would your words of wisdom be to people who are perhaps early in pregnancy and maybe are a bit, understandably anxious and uncertain about what's coming? We learn more about this infection every day, and I'm curious, sort of what your advice might be for folks who perhaps are just finding out they are pregnant or are just into early pregnancy. Sally, I'll start with you.
Sure. So I think like I've said before, just talking to your provider as much as you can about how things might be affected, and just getting all of that information, reading stories online or exchanging stories with other people could be helpful. And then just like really thinking about what you're going to be comfortable with in your pregnancy and postpartum period, in terms of like having visitors and maybe starting to have those conversations with people to like set expectations about visits and stuff like that.
Yeah. And Abriana, are you available to?
Oh,
okay.
Yeah.
We'll come back to you. Oh, you're available?
Oh, no, you can come back to me.
Okay. Sarah, any words of wisdom that you would share with folks who are on the other end of this process?
So, I mean, I know people personally who have passed away or have been very ill in the hospital with COVID. For me, that was not my experience. And I attribute that to really like staying as healthy as possible while I was pregnant and taking your vitamins and getting your exercise and everything. So I hope that reassures people to think like that, if you just stay in bed and drink tea and eat your soup, like you can get through it. Besides that, I would really just say like, yeah, have a good provider. COVID or not, people change their providers all the time. And if you don't feel like you're getting some sort of support that you need, whether it's related to COVID or not, or related to your mental health or not, or they don't support your birth preferences, you can absolutely seek out another provider that you feel more comfortable working with. And I think now more than ever, like go back to that core of like nutrition, exercise, stress relief, like some sort of mindfulness, meditation, yoga, whatever works for you. Like just focus on those 3 things and you'll be okay.
Love it. Back to basics. We do have a question from Erin Rainwright, and I think this is an interesting one. She says, thank you ladies for sharing your stories. I'm a labor and delivery nurse and part of the COVID team at my institution. I've been lucky to be part of quite a few birth stories with COVID positive mamas, both asymptomatic and symptomatic. And I'm very interested in seeing things from the perspective of the mothers giving birth. We as nurses are trying our best to keep things quote unquote normal as possible. Can you articulate what your birth team or your providers did right that stuck with you? And are you also able to give some constructive criticism about what we could do better? So Abriana, if you're able to talk, I'll go back to you.
Yeah, that's fine. I think all my nurses and doctors did a great job. I saw them, wiping all the equipment down, using, sanitary practices. So just keep up with that. It just definitely brings us a peace of mind knowing that you're taking that extra step to make sure that we feel like we're cared for and that we're in a safe environment and we can, relax. Because birth, let's face it, is stressful enough in itself. So you don't need that extra layer of stress or anything like that. I didn't really have any critiques or anything. So I think just keep doing what you're doing and we thank you for everything that you guys do for us.
Awesome. Bonfilia, can I ask you if you can sort of share with us something that your birth team did that you really recall was very helpful to you, and perhaps a suggestion for what the birth team could maybe do better to
Bueno,
make
Filia,
women.
¿puedo preguntarle a usted qué fueron algunas acciones que su equipo médico, los que le asistieron en el nacimiento, hicieron bien con respecto a usted, las precauciones que tomaron y tal vez alguna sugerencia de lo que ellos pueden mejorar, alguna cosa que ellos pueden hacer mejor en el cuidado? I think everything was perfect. Even though I was very anxious and I was going in with a lot of fear, I thought that everything was discreet in a way. The baby was born and then everybody was out and then just a nurse stayed there helping with the baby.
Okay, I love hearing these fantastic stories. I think COVID in some ways has sort of raised our game. Sally, I don't think you had a chance to answer that. Anything that you think was particularly reassuring, and anything maybe teams could reflect on and do better?
Yeah, I just had a really wonderful experience with the doctors and nurses and everybody on the team who helped me deliver and postpartum. I can't really think of anything that I would have asked differently. It was just like a very positive experience where people were sort of just calm. And in terms of COVID, like I said, I sort of forgot that it was even a factor, and I think the team just wasn't really bringing it up or making me think about it. So just don't focus too much on COVID if you don't have to, other than just taking the precautions as normal.
And I think that's impressive, Sally, because you delivered, a few months ago when I think hospitals were still kind of getting organized. So when you guys were sort of the trailblazers, because you were probably some of people's first COVID births. We have another question from Emma Sachs, and she asks, she says, first, thank you so much for sharing your experiences, especially when multitasking. She says, I'm curious to hear more about the hospital policies around maternal newborn separation while waiting for test results or if infected. Was it common in all of the hospitals or homes where you delivered? Did some of the policies change over time? What were your opinions? Was opting out an option if you chose to keep the baby with you? So I think really Emma's raising this critical question, which has been so gut-wrenching for parents and providers, is the separation issue. Anybody want to speak to that? Maybe I'll take a volunteer.
Sure. So I'll say that I remember asking my provider about the separation, and I remember her telling me, it's your baby. It's your decision if you want to keep your baby, if you do test positive. And like I said, having that like informed consent that I brought to the hospital with me, I didn't have to use it. But knowing that I could refuse separation was helpful. I can't remember if Hopkins policy changed over time. I think that at this point, most hospitals are not separating as long as you're COVID negative. And I got my COVID result really quickly before I was even like admitted into labor. So I didn't have to like worry about waiting for the test result. It was very fast. That was my experience.
Bonfilia, do you have any insights on the question of infant mother separation? Did that ever come up in your hospital stay? Was that ever a concern?
Bonfilia, ¿usted tiene alguna sugerencia sobre el tema de la separación entre la mamá y el recién nacido? ¿Fue alguna vez un tipo de conversación entre usted y su proveedor si eso sucedería o si iba a ser necesario? No, they didn't tell me that. ¿No le mencionaron si usted era positiva, le iban a separar de su bebé por ese tiempo, si los iban a aislar? What happened was that when I was getting closer to labor, I stopped going to my appointments because I was afraid. And I just went back to the last appointment because they were calling me constantly. And there was such a fear about COVID that people would tell you stories about, if you go there, you're gonna get infected there. And then I went to the last appointment, but there was still a week left to have my baby, and they said, well, you still need 1 more week to go. But luckily, my baby was born before the end of the week, and so.
So I'm sitting here hearing, you know, these stories. You've experienced job changes, job losses, gaps in care because of fear around the virus. You know, last minute tests that were going to determine where you know, could deliver and who would be there to assist you. This is an amazing roller coaster. We only have just a few minutes left. I have a few pictures, and I apologize, Sarah, you have luckily provided us with AJ, so we got this bonus viewing. But I just wanted to show a couple of pictures. Bonfilia, I'm afraid I wasn't able to get photos, but I'm just going to just briefly just show you the images I have, just to kind of end on a light note here, so that you guys can see. If I can just pull these up for you.
Can I say one thing, Nicole?
Yeah, please, and I'll try and find my.
So one thing that I did in that last month was I did have some appointments via telemedicine. So you could ask your provider if that is an option. So they just like had me weigh myself at home, and we actually have a blood pressure cuff here, so I was able to take my own blood pressure. But that kind of we just decided to do that to reduce the risk of getting COVID by going out, basically.
Brianna, what about the impact? Did you have any telemedicine? Oh, sorry.
Sorry. My midwife had everyone get a fetoscope and a blood pressure cuff, and I think she was doing like every other visit telemedicine, and then she decided from 36 on she wanted all of those in person, but mine were virtual because I had COVID. So. But yeah, it was, you know, it was cool being able to like try to find your baby's positioning and listening to their heartbeat. But then it was also like an extra burden because you're like, this is not my job. When is amateur hour going to be over?
Okay, Sarah, I love the adaptations you described there. They're not dissimilar from what Sally experienced in a very different care setting. Brianna, what about you? Just quickly, any changes to your antenatal care? Any adaptations you saw being made?
So during my pregnancy, I unfortunately could not do telemedicine, and it was very hard to attend my appointments because I had to drop my son off somewhere, and everybody worked during the day. My husband couldn't keep calling off for every single appointment every single week. So I did end up, you know, missing 2 or 3 of my appointments. And I was already getting, you know, late prenatal care from, you know, moving from state to state. So it was definitely very difficult. Same thing for like, you know, postpartum care. I couldn't bring either one of the kids or anything, which I do understand because I don't want to expose them. But at the same time, it did put an extra unnecessary burden on me. Because, you know, what are we supposed to do as women? Like, we need to be checked to make sure everything's okay. And that's kind of like a coin toss. Like, am I going to, you know, put my health at a 50-50 and just hope that everything's okay? Or do I take that risk and, you know, go in and try to work around everything? So it was definitely very difficult.
Well, I think you've all sort of driven home something that is a wonderful takeaway. We have providers listening, hopefully some expectant families as well. You're helping us understand the context of people's lives and all of its richness and its difficulties and its victories. But when people miss care, your stories have really helped me kind of understand those absences better, and I hope make me a more empathetic provider, because people are struggling to make these tough choices. So wow, it's just, I learned a lot. So I appreciate that. We really just have a couple minutes left, and honestly, the images here, I don't want to mess with what's working. So I'm going to leave the slides for the moment and make sure we just have a chance for people to sort of make any last comments they want to. Bonfilia, can I start with you, and we'll just go around and sort of sign off? We've got, oh, there we go. All right. Yoni, I don't know if you're still in touch with Bonfilia, but if she has any sort of parting words of wisdom, and then we'll check in with the others.
¿Usted, Bonfili, algún consejo que darnos ahorita que ya vamos a terminar? Tal vez unas últimas palabras. Just to be very precautions with the family, take the necessary precautions with the family.
Okay. And then Sally, you've got a new person there on the scene. Just
So yeah, Ada has just woken up from a nap, and I thought it'd be fun to bring her on for a second. So, but just yeah, thanks for having me. It was really fun to participate, and yeah, my heart goes out to anybody who is pregnant right now. It's like an extra layer of just sort of complication, but I hope that you know, we've made you feel a little bit better, and like it'll be okay.
thank you so much. Aubriana, you want to parting words of wisdom?
Yeah, so my best advice is knowledge is power. And I'm not saying, go out and read every parent book that you can and fill your brain with the necessary knowledge, but just, keeping yourself informed will definitely calm you down more. And the more that you know about what you're going into, the less you have to worry about, the unknowns. So just to better prepare yourself, whatever you need to research, look up for your own, sanity and comfort, definitely do that. And like I said before, you know yourself better than anybody else. And like Sarah was saying earlier, if you feel like you're not getting the proper care, speak up for yourself. Be an advocate for you. And if you feel like you need a second opinion, there's millions of doctors out there, So you know yourself best and you can do it, I promise.
Thank you so much. Sarah, parting words of wisdom. You got a sleepy baby there.
Yeah, I mean, just everything that I've already said. Have a provider you trust. Focus on, your health, your nutrition, your exercise, and take it one day at a time. And when you have your baby, you're going to take it one day at a time. And a lot of times that's going to be 1 hour and even 1 minute at a time, but you're going to do it. And yeah.
All right. So before we go, I want to say a few quick thank you. Maxine Reed Vance, Sarah Dutton, Isabel Fernandez Buenza. Who else? Oh, of course, Habiba Oguntade, who's behind the scenes here making some of the technology work, and everybody who joined us. This has been amazing and such an awesome compliment to the medical experts, because we need that medical expertise and we also need your expertise. And I feel like you brought that to us today. So I am grateful. I thank you. Enjoy your little ones in your time. And of course, I wish you health and happiness, especially Aubriana. I hope you're home soon and with your little one. And please join us for the next MD webinar, and just go to mdmom.org and you'll find details. So thank you, everybody.
Thank you.